This is a great group. I'm so glad that you guys could all join us today. I'm going to tell you a little bit about Graham. He's originally from Prince Albert, and Graham brings over 15 years of experience working in the nonprofit sector. He has held various positions in volunteer coordination, fund development, right up my league, program development, management, and governance, most recently with the University of Saskatchewan, right here in Saskatoon. I've had the pleasure of working with Graham over the last few months, and I'm happy to introduce you to our new executive director, Graham Dickson. So take it away, Graham.
Hi, everyone. This is actually a huge number of people that are taking part in this. This is really nice to see. I thought maybe I'll just talk a little bit about myself briefly, and then I want to talk a bit about how COVID has affected the SPCA, some of the challenges we're currently facing, and then I want to talk about our vision for the future and where we're going. I will point out that our board chair is taking part. Her name's Jane Caulfield. You want to give her a wave? There she is. If you throw a question at me that I'm not prepared to answer, I might rope Jane in to help me out. So about me, I was born here in Saskatoon, but I grew up in Prince Albert. Like a lot of people my age, I was really quick to leave the province, but I came back. I've had about 15 years, more or less, experience in the nonprofit sector. As Nella mentioned, I've worked in affordable housing, in the disability sector, up in kind of more remote northern areas of Saskatchewan. I've worked with at-risk youth. I've spent most of my career advocating for more vulnerable populations. So I'm really excited to be here at the SPCA. When this opportunity presented itself, I was very excited, and it's kind of hard to express how glad I am to be here in this position right now. I started in this role on March 9th, which, if you've been following recent events, is really strange timing. I have friends who got married about a week ago. They originally were planning a huge wedding, but they ended up just having a small ceremony with 6 people, and I was lucky enough to take part. And the photographer showed up, and it was someone that I knew. I wasn't expecting to see them. I hadn't seen them in years. And the first thing I did was reach out and shake their hand, and immediately, full of regret, but also it reminded me how much I miss shaking people's hands. And I had every intention of, in my first 3 months in this role, getting out of the office and meeting you, the folks on this call right now. I was really looking forward to shaking your hands, getting to know you, hearing from you, your thoughts on the SPCA, finding out how we can keep serving the community. So this has been challenging for me. So it doesn't matter how many of these Zoom calls I'm on, they're always really awkward. I'm going to do my best to get through this without being too awkward. But before I go any further, a couple things. If you want to reach out to me one-on-one, please do. I'd be more than happy to have a conversation with you over the phone or by email. I think it's really important to get a good understanding of who our stakeholders are and hear feedback from you as to how we can improve. I'll also say we generally have our AGMs in April. We postponed that because of COVID. We will be having an AGM. We'll probably do it through Zoom or a platform like this. We have yet to set a date, but I wanted to flag that for all of you to take part in that. And as soon as we have information, we'll share that with everyone. So I would encourage you to subscribe to our newsletter if you haven't already, and maybe I'll ask Nella to share some information at the end of this about how you can subscribe to that. So enough about me and my background. COVID. In terms of where you are in Canada, I guess you would have been affected by it differently geographically, but for us, and especially in the shelter community, March 16th was sort of the banner day. That was the day that things really changed. So that was 7 days after I started. So needless to say, it's been sort of a crash course in emergency management. But we've had an incredible amount of support from the community. It's been really amazing, and I want to thank you all. I know a lot of you on this taking part of this call right now were a huge help to us during that time. So thank you for that. We really didn't know what was going on, like everyone. It was sort of it was a difficult stretch of time. I'll say that. It really forced us to pivot and innovate, and I'll talk a little bit about how we adapted and how we adjusted during that time, and also talk about how those changes might carry over into the future. On March 16th, the day that COVID hit, we had 133 animals in-house. And our biggest concern as a team was what happens if we get shut down, if we're forced to close our doors. We're really worried about the welfare of those animals. So we decided just to waive any barrier would be to adopt and to put a call to the public and say, we've got animals in house, we need to put them in homes, come out, adopt, there's no fees associated with it. And in 2 weeks, we adopted out 157 animals. So you might notice that that's more than we had in-house on March 16th. We continued to take animals in during that time. And I should also note that the number of animals that we were bringing in and adopting out was higher than normal for the 3 months leading up to that as well. So I have to give kudos to our staff, some of which are on this call right now. I know they worked relentlessly and tirelessly to get those animals into their forever homes. And it was pretty amazing to see. After that time, we actually were designated an essential service by the provincial government, which we're very grateful for. So it's allowed us to stay open and still serve the community, focusing mostly on emergency issues. But we did have to lay off about 60% of our staff, which was difficult. And seeing the effort that the staff put in to adopt all those animals, knowing they were working themselves out of a job was incredible. I can't say enough good things about the team we have here. So 60% of our staff were laid off. I think we're still up at about that rate right now, although we are still bringing people back in house. And we closed to the public. So one of the challenges that we faced was how do we still care for animals that need to be in the shelter, but also maintain social distancing and reduce the risk of spreading the virus in the house. My nightmare was one of our team members being exposed to the virus, contracting the virus, and then having everyone in house because we work in close quarters, having to quarantine. Thankfully, that didn't happen. And for those of you who've been in our shelter, you'll know that it's a small space, particularly in the health wing and the examination room. It's really hard to perform procedures or to examine animals in such a small space and give co-workers 6 feet of space. So we've implemented a lot of practices to mitigate that. We've got a pretty rigid hand sanitizing regime. Anyone that comes into the building now is asked to sanitize their hands, wash their hands. And we're closed to the public. So as of late March, after we adopted all the animals out of the shelter, we're closed to the public, and today we're still not open to the public. We're only letting people in on an appointment-only basis for adoptions, which has been challenging. And this is where we were forced to pivot and innovate. I know a lot of people want to come in and see the different animals we have up for adoption and see what's available, but it was a risk that I felt wasn't worth taking. The animals that we have available are all available online, and the public has been really understanding and accommodating on this front. And we've learned a couple of lessons from this. The rates of upper respiratory infection or common illnesses you would see in shelter animals has gone down significantly to the point where I think for quite a significant amount of time we had no cases of URI in house at all. So that's partly to do with the limited number of animals we have in house, but also to do with the limited number of the public we have in house, removing cats from their kennels, mixing them up with other cats, and you get bugs and germs get transferred that way. So we're looking at controlling and limiting the access the public has to the shelter in the future, at least for the next year or so. We're anticipating, as I think everyone is, to a second or possibly third wave of COVID. So what we're trying to do right now is just learn lessons from what we experienced over the last 3 months and remain nimble and agile so that when and if this does happen again, we know exactly what process we need to undertake to ensure the safety of the animals and our staff. Obviously, one of the things that we had to also eliminate was public events, which is problematic. And I know Nella can attest to that because it's a big part of what she does is public events for fundraising, for educational purposes. Obviously, like everyone on this call, I'm sure we're all missing that part of our lives. It's taken it's impacted our fundraising efforts as well. And I think maybe broadly speaking, the shelter industry has been somewhat overlooked by funders through this time. Um, so currently, I want to talk a little bit more about what we're facing today. Um, One of the things that is an ongoing challenge is as we bring staff back in-house and the number of people we have in the shelter increases, the risk of transmission increases as well. So we're really trying to strike a balance between allowing the public to come in, adopt animals, and yet mitigate transmission of a COVID virus in-house. So we're using our auditorium. I know not everyone on this call has been in-house here, but for those of you who have, when you enter our building and turn right, we have a large auditorium we use for public events and for meetings. We're using that as sort of a social space for people to come and visit with animals if they're interested in adopting. We've got a pretty rigid system in place where people can make appointments half-hour chunks of time. The space is sanitized before people come in and after they leave. We've got plastic barriers up at our front desk, the same type of thing you'll see at the grocery store or anywhere else. We really want to make it as open to the public as possible, but as safe as possible as well. The big challenge for me right now, seeing what an impact it had on our shelter getting our population down, was the decrease in medical care that the animals needed with the decrease in rates of upper respiratory infections. So the challenge I'm giving myself right now and going forward is to reduce the number of animals in the shelter that don't need to be here. Healthy adult animals, by and large, don't need to be in the shelter. And the challenge I've given our team is to find ways to reduce the number of those animals, those creatures here in the shelter. I'm also, as a team, we're trying to track how long, on average, an animal stays in shelter, and we're trying to measure that and keep that as low as possible. For the same reason, shelters aren't a place where animals thrive. Our function is to get them through here as quickly as possible and into proper homes. So as always, I don't think this is not a new issue, but increasing the rates of spays and neuters in the community is an ongoing challenge. It's particularly challenging right now. We've got a lot of veterinary clinics that aren't operating at full capacity, so our ability to have our cats and dogs spayed and neutered has been somewhat hampered. More broadly speaking, and even just thinking outside of the COVID context, I know there's financial barriers in place as well. And maybe just awareness of the importance of having your pet spayed or neutered. These are really important issues. And I have to say, not being from the animal welfare sector originally, I have a new appreciation for Bob Barker and his insistence on always reminding his viewers to spay and neuter their animals. For a stretch here, I was having dreams every night where there was just cats everywhere. I would open a drawer to get my car keys and it was full of cats. And I'm sure those of you taking part in this call have an appreciation for the challenges we face on the cat front. I want to talk a bit about the future, the vision for the future, but maybe before that, I'm wondering if there's any questions specific to COVID right now that people have. Nell, is there anything that I can address right now before we move on?
Let me look here. So the chat box is open. I do have one question in regards to COVID. So with COVID-19 and the changes that it's made, how we have always, in regards to how we've always done things, how do you see the public and the community playing a role in the future of the Saskatoon SPCA?
Okay. A
nice, easy one for you, Graham.
Well, that's a good question, actually, because that really plays into my vision for the future. I had the opportunity to take part in several chats like this with shelter operators from across Canada, and that was facilitated by Humane Canada, and those were tremendously valuable for me because I was able to see that the challenges we were facing here in-house were no different than what shelters were facing across the country. One big takeaway for me was the increased ability for shelters to cope with this that had a really robust foster system and had the ability to, rather than waive adoption fees and adopt out every animal, they were able to temporarily place these animals in care in homes across the community. And when the time is right, bring them back, adopt them out. They were able to organizations that had that robust foster system were really able to absorb this crisis and cope with it more effectively. So I see that as a direction we need to go on an ongoing basis in the future. I think the role of the public in the community post-COVID is going to be very important. This crisis has shed light on how we can operate more efficiently and effectively, and that's something that shelter operators across Canada are saying, that they're realizing that the way we've done things in the past is maybe not necessarily the best way. So I'm going to use this as a segue into my vision for the future, because this is really part and parcel of that. Saskatoon's been growing for many years, and the challenge in front of us right now is to grow alongside with it. And I've got really big ambitions for this organization. My goal, and I tell my team this probably on a weekly basis, that I want us to become the gold standard SPCA or shelter in the country. I want people to point to Saskatoon and say, go see what they're doing in Saskatoon. They're doing some really neat things. We have so much potential here. There's so many exciting things happening that could happen, and the wealth of knowledge that we have in-house here is tremendous. I know across the nonprofit sector, the turnover rate for employees is like 1 or 2 years. We've got a large number of staff that have been here for upwards of 10 years. And over that time, they've accumulated an immense amount of knowledge and experience. And my vision for the future is to get that knowledge and experience and get it outside of these walls and into the hands of the public. I talked a bit about how COVID has illuminated the changes that we could undertake across the country in terms of shelter operations. I think it's fair to say that this is a real time of change. I'm an optimist. I see COVID as an opportunity for us to take advantage of and to adapt and to be better coming out of it. And that's the mindset I've adopted through this. I believe, and I've been challenging our team to adopt the mindset that animal suffering it's not the problem, it's a symptom of the problem. The real problem is poor decisions made by people. We're in the people-changing business. If we focus all of our resources and attention on the suffering of animals, we're only addressing the symptom, and we'll never address the real problem, which is a people problem. I think education is central to this. The vision that the Saskatoon SPCA has is, this may not be verbatim, but I think it's really close, is a compassionate community where animals are cared for and respected. And we're not going to build that community if we don't get out of the walls of this shelter, engage with the public, and leverage our relationships with the folks like you taking part in this conversation right now. And maybe going back to the question that you brought up, Nella, how do I see the community playing a role post-COVID? I want to activate our partners in the public and think of them as viruses. And this is maybe a poor timing for that analogy, but I passionately believe that people who partner with us and are passionate about animal welfare, they're going to spread that enthusiasm. It's infectious, and their neighbors, the people they come into contact with, who they talk about the SPCA to, are then going to know a bit more about who we are and what we do, the importance of building a humane community, and the importance of spays and neuters, for instance. And I talked about this already. I think the goal for us going forward is to reduce the number of animals that we have in the shelter, and that's really controlling the intake of animals. If animals don't need to be here, we need to give the public other resources and alternatives to deal with those animals, rather than bring them into the shelter where their stress levels will be higher. They'll have an increased risk of contracting infections. Keep them in homes or in our foster partners. We have the ability to enrich the lives of animals when they're here in the shelter, and I think that's a role that a lot of volunteers want to help us with. I went through kind of an assessing how we have done things historically and how we do things now, and I'm just so amazed at how many people have reached out to us and said, how can I help? I'm more than happy to come out and walk a dog or to play with a cat. Of course, who doesn't want to do those things? Let's build opportunities for the community to play those roles and enriching the lives of the animals while they're here. And ultimately, I think our vision as unrealistic as it might be, is to work ourselves out of a job. If we can build that compassionate community where animals are cared for and respected, we shouldn't have to exist anymore, and that should be our ultimate goal. And I talked a bit about this already, about getting out of the shelter and doing more in the community. I see things that other organizations are doing, like in Vancouver, where they have, I think, monthly clinics they set up in the core neighborhoods, in a gymnasium or a big community space where they have volunteer veterinarians take part, and people can bring their creatures to the center on this one day of the month and get feedback about animal care, about nutrition, about advice on animal behavior, whatever. We could also maybe use that as a hub to provide food for individuals who have a pet but maybe are living below poverty level and struggle to feed their pets. There's no reason why I don't think why we can't do that as well. The challenge I've given our team here is to think outside the box and outside of the shelter and figure out how we can invest in the education, invest in the public, and thereby reduce the number of animals coming here unnecessarily. There has been a lot of work previous to my time here in terms of building capacity for us to do spays and neuters in-house. That's going to play a huge part in the future as well. How that's going to play it, I don't know. This is one of the problems that COVID has presented, is those plans have been somewhat derailed. But it is still, I think, and Jane would probably verify this, I think, our board chair, that it is something that we're really passionate about as an organization, is increasing our capacity care, increasing our capacity to actually perform more of these medical procedures in-house. The more of that we can do, the more resources it frees up for us to spend on enriching animals' lives in our shelter and outside the shelter. I feel like I've been rambling for some time here, and like I said earlier, these Zoom calls are just really awkward for me. Maybe in part because I chose to grow out a mustache during quarantine, and I'm not quite used to looking at myself with the mustache, so this is all very awkward. I do want to say once again, our AGM, we haven't picked a date yet, but it is coming up shortly. The strength of our organization starts at the board level. We've got a really engaged board, and I would like to see more people become members of the organization and provide direction and guidance and accountability to our organization. So if you're not a member right now, we would love to have you as one. I'd encourage you to keep an eye out for information on when that AGM is being held. As I said, it will probably be done through Zoom. We're going to work out some challenges around how we might vote, hold elections and things like that. Those are things we're going to look to other organizations to see how they've done this successfully and build on that. And again, I just want to thank you all for taking part in this. This is not the way I envisioned meeting you all. I had every intention of going out and, like I said, shaking hands. I'm an extrovert. I want to go and meet people and glad hand. But I think Woody Allen once said the best way to make God laugh is to tell him about your plans. And that couldn't be more true than what we've experienced here in the last few months. So Nell, I'll kick it back to you. If people have questions, specific questions or comments or feedback, I'd love to hear it.
Absolutely. There are a few questions for you, Graham. So I'll just read them out to you and then let you have at it. So Graham, you mentioned that public access may occur differently continuing in the future. Were you referring to a continuation of appointment-based viewing, or do you have other thoughts on how public attendance at the shelter can continue in a safe manner?
Yeah. Something we bring up in-house here almost on a daily basis about how do we balance the need for public access with the safety of the critters in-house here and our staff. I think it's safe to say that things won't look the same way they did previous to this. I can't say exactly what they will look like. I think having public access 7 days a week won't carry forward. It would maybe be half days or a few days of the week. Those details we don't really have worked out yet. We want to take into consideration that people have limited time available, and we want to remain flexible. We don't want our public hours to be a barrier to people adopting one of our animals. this is an ongoing issue. As I said, it's kind of hard to answer because I don't know how it's going to shake out in the long term. But I will say the adoption process has been running really smoothly since we've gone to the appointment basis. It's given our staff a bit more time to spend quality time with the public when they're visiting the animals. And I spend a lot of time talking about my vision for the future, and the cornerstone of that is education and community engagement. And I think any opportunity that we have for our staff to spend more time with the public and push them along that spectrum of being more knowledgeable about animal welfare and humane treatment of animals, the better we're going to be doing our job. So I do anticipate that at least for the next, I would say for the next year, we're going to continue with adoptions by appointment only. But having said that, right, plans, I could talk about plans now, but of course, who knows what's around the corner? Hard to say.
Absolutely. Okay, so another question for you, Graham, is this one's related to COVID. Have the limitations on fundraising and public engagement due to COVID-19 affected the Saskatoon SPCA's ability to respond to animal protection related calls?
No. We had not laid off any of our animal protection officers. We have funding in place for that specific work that funds, and that's from the city of Saskatoon, that funds the work that the animal protection officers do. We call them APOs. I'm trying really hard not to use acronyms. If I have, please call me on it, because I know once you get immersed in this world, it's easy to start using acronyms. We're very fortunate. We have a really good relationship with the city. And I know there's probably members of the city administration on this call right now, and they would attest to the fact that they've been very supportive of us. And we very appreciate that. That work has not been reduced. The only way that it has been impacted is limiting the contact with the public. So we asked our AP officers to be extra vigilant, wear personal protective equipment, masks, gloves, things of that nature. We also gave them direction not to go to people's homes as they normally would to respond to call. They get all in different kind of number of different calls they get on a daily basis. A lot of them require going into homes. We asked them for the time being to stop going into homes where not necessary if it's not an emergency situation. So in that respect, it's been somewhat impacted, but by and large, it remains stable.
Perfect. The biannual open house has been one of the auxiliaries, the SPCA auxiliaries' best fundraisers. Is this something that will now fall by the wayside?
I hope not. Are there any, I'm curious, is there anyone on this call from the auxiliary?
Yes, absolutely.
Okay.
Leslie's
I see
here.
Leslie waving. I think there's probably people on here that I can't see right now, but thank you very much for your ongoing support. We had a fundraising event called Giving Tuesday in May. I think it was early May. And for those of you who aren't aware, the auxiliary contributed $10,000, a matching $10,000 gift for funds raised by the public, and ended up bringing in about $25,000 in total. And that's money that all goes towards the medical care and treatment of the animals in house here, which is a tremendous help. So for those of you on this call from auxiliary, thank you. And I know you've been involved with this organization for many years. You're one of the first groups of people that I wanted to get out and meet. So I'm really glad to see a few of you here. Yeah, the open house, we may have to be innovative in how we roll something like that out in the future. I would like to see it happen. And I'd be more than happy to chat with you one-on-one after this and maybe figure out ways we can continue to do this, because it's a huge value to this organization.
Absolutely. Graham, can you speak to the expansion plans that were announced last year? Where do things stand with this project? And I believe they're referring to the clinic.
Yeah, so as I said, a lot of work had gone into this. As far as even having specs drawn up for what the clinic would look like, where it would be built. Costing had gone through, we're doing a financial analysis. I think having one of the directions I got from the board early on was, this is a huge priority for us. We want you to spearhead this and carry this forward. COVID hit, and it just, it's derailed it, to be honest. I mean, this is just not a good time to go to the public for a major capital campaign. People are all adapted to a new normal. Times are tough for everyone right now, so we decided to temporarily put that on hold. The plan right now is to carry that forward when the time is right. I really believe that our ability to be successful on that front is going to be reliant on our relationship with the community, people here on this call. So I see this as a step towards that. It'd be of critical importance for us to have that clinic built and to be able to provide space and meters for an affordable price for the public. It's been frustrating. I can speak for the board saying it's been frustrating to have to put that on hold because everything was in place for that to be carried forward. Again, I can't say what's going to happen next, but I will say this is something we will pick up when the time is right, and we have the intention of moving forward.
Great. What role do you feel, what role do you feel nutrition plays in the lives of the pets in shelter, through their recovery, through their adoption process, and into the future?
That's a good question. You know, there's only so much we can control when animals are in the shelter here. One thing we do have control over is nutrition. So when animals are here in house, it's of critical importance that they are given the right diet based on their individual need. It's of huge importance. I mean, in any stage of life or any living condition, nutrition is of vital importance. We've been really fortunate in getting a lot of food donations given to us through this time and historically. So I'm really grateful for that. One of the things that is going to be a challenge for us and that we're currently working on is as we build this foster care program and increase the number of animals we have being cared for in our partners' homes in the community, is to ensure that the right food is in place for those animals, to train the members of the public who are acting as foster cares providers to identify and provide us information with the animals' dietary needs or reaction to medication they might be on. It's of critical importance. As I said, there's only so much we can control when the animals are in house. Stress levels are usually high. The quality of life is temporarily impacted. The one thing that we can't control is nutrition, and we go to great lengths to make sure that we're providing the best that we can for them in terms of food. I hope that answered the question.
I think so.
Okay.
I think so. I've heard a lot about kitten season. Can you elaborate? What does that mean?
So kitten season is something that we lovingly refer to as spring. It's sort of a predictable time when the number of kittens we see through the shelter decreases significantly. I think it's usually about 3 times a year, but spring is the one time. I think if you speak to any shelter operator across the country, they'll all experience the same thing. Huge intake in the number of kittens that come through our doors. I talked about the dreams I was having where everywhere I looked there was cats. That's the direct result of what we call kitten season. It usually starts in, I think, April, looking historically at our stats. One of the challenges that we have is to educate the public as to when found or unowned cats should be brought into the shelter and when they should not. A lot of times, these cats are actually better off out of the shelter if the mother is around. So we ask people to keep an eye on them and not immediately reactionarily just grab those cats and bring them in, because if it's an adult cat, it could be caring for kittens. If it's a kitten, the female cat, the mother could be around but gathering food for the kittens. So we put together, we're working closely with animal control in the city to give the public the resources that they need to help make those decisions and ascertain whether or not animals in distress or not. This is a real challenge during kitten season, which is what we're experiencing right now. And I'll add to that and say that COVID happened right overlapped with that what we call kitten season perfectly. So it's been a huge concern of ours, the welfare of these animals that are unowned and out in the community, and we've been working really hard with our partners, including SCAT and others, to mitigate any interruption to service that may have been experienced during COVID and as it affects kittens.
Great. You touched a little bit about when to bring an animal into shelter. Are you still accepting animals?
We are, yes. So we are not, we don't collect animals that are found stray or abandoned. That's in the realm of animal control. We do respond if an animal is in distress, and that hasn't changed. As I alluded to earlier, we've asked the public, and we've worked really closely with that and the Animal Control Authority we've asked the public to, if they have a cat or a dog they found wandering astray, to crate it or trap it, and it will be collected at that point. But as I said earlier, the big challenge is keeping the animals that don't need to be in house, keeping them out of the shelter. Now I'll come back to cats again. I think cats are 13 times more likely to find their home if left to their own devices and things like Facebook pages and things like that. Once they're in the shelter, their chance of being redeemed is quite low. I think only 7% of cats that end up in the shelter are redeemed by their owners, which was a surprising stat for me to learn. But yes, to answer your question, I feel I'm getting kind of rambly now. To answer your question, yeah, we are still accepting animals.
Now, if somebody wants to help and volunteer, I don't see opportunities online. How do they go about doing that? Or wants to foster?
Right. The best way would be to call us or send an email to us and indicate your desire to help out. We're always looking for help, for volunteer help. So I would encourage anyone who's interested to email. The best place right now would be info@SaskatoonSPCA.com, or to call us. Our number is 306-374-PETS. That's 374-7387. I'm still learning the number, as you can see. I'm so green. That's probably the best way. Our staff answering the phones would be more than happy to provide you with information and connect you with the right person to talk to, depending on how you want to help out. I want to thank everyone once again for taking part in this. This has been tremendous. Just to know that this many people are interested in what's happening here and would take an hour out of their day to listen to me ramble on. And it's just really heartening to know that people care about the organization and want to support us in our mission. I don't know, maybe Jane, is there anything that you wanted to add as chair of the board to what we discussed? That
we actually have a question from Jane.
Oh, okay.
Will these chats become a regular thing?
You know, I think we're going to set up a survey to send out to all of you for feedback on how you enjoy this. I think we should keep doing it in the future. I would love to see that. If we get a positive reaction from you folks who took part in this today, I'd be more than happy to do this again. I don't know when normal is going to come back, and I don't know if normal ever will come back. And I think if we could reach more people by meeting remotely like this, then why wouldn't we continue to do this? I would be really, really happy to see us continue this.
Perfect. I think that's all the questions from the group today. So thank you so much, Graham, for the update. And I hope you all enjoyed meeting Graham. Like he said, the AGM will be coming up. It will be virtual. We don't have all the details, but if you are not subscribed to our newsletter, this is a great time to do so. And you can do that by just going onto our website at www.saskatoonspca.com. Graham has also opened up his email. So if you have questions and you want to talk to him or you want to chat or you have something to say, you can feel free to give him a shout. Thanks, Graham. Thanks, everyone.
I look forward to hearing from you. Please do reach out to me if you've got questions. I'd be more than happy to chat with you one-on-one.
If you have any questions, I will be sending out a survey following this call today. It's super simple. It's just a few questions. It'll help me. It'll help us improve and be better. And if you could just fill it out, it's also anonymous. So please let us know exactly what you're thinking. And it's the only way we're going to improve. So I appreciate your time. I appreciate everybody coming out today. And if after this call you think, oh, I thought of something and I should have asked, shoot us an email and we'll be happy to answer that for you. I hope you have a good rest of your day, and I'm glad to see everyone's doing so well. Bye for now.